Hi, this is Dr. Lili with my Pocket Pediatrician, and today I want to talk about constipation.
When the doctor says my child has a condition, I'll learn more at my Pocket Pediatrician.
Hi, this is Dr. Lili with my Pocket Pediatrician. Today we're going to talk about the ins and outs of constipation. So constipation means you're either having very infrequent stools or you're having very hard, dry, difficult to pass stools. Sometimes it can be tiny little nuggets, sometimes it can be big, huge, hard balls of stool. Usually when the stool is very large and hard, you can also wind up with little blood streaks in it because you can cause some tearing around the anal area as it's coming out. Constipation can be very uncomfortable. There's even something called encopresis, which means that you can have such a big ball of stool stuck in the colon that liquid stool goes around it. And so sometimes kids are soiling or people think they're having diarrhea when actually they're constipated, and then it's just sort of some liquid stool coming around the outside of it that they can't control. Constipation can also lead to urinary infections, urinary retention, bedwetting. It can cause a lot of problems for kids, and it can be kind of a very emotional issue. A lot of parents notice behavior problems when their child is constipated because they're uncomfortable. They're feeling backed up and they can't get it out, and so they get aggravated, frustrated. They sometimes act out emotionally. So it can be a huge issue for kids. When I'm working in the ER and somebody comes in with abdominal pain, the first thing I ask is about what they're eating and how they're pooping, because those are two big clues for me to figure out what's going on and what's causing this pain. There are obviously a lot of other causes of abdominal pain in children, but this is kind of the most frequent thing I see, and so I kind of want to get that history in there and figure out what's going on. When I ask about what a child's eating, very often the answer includes a lot of cheese, meat, processed foods, very little vegetables or fruit, no whole grains, and so that's kind of an easy fix right there. I personally don't like starting out with medications. I feel like a lot of times you can manage constipation with diet if the cause of it is poor diet. There are medical and genetic conditions that can cause chronic constipation, but fixing the diet is going to be the first step every time. If you don't have a good diet, you're going to wind up on medication for constipation the rest of your life, and it's much easier to fix the diet than to be on chronic medications. The first thing I always tell people is to avoid foods that are constipating. White rice, bananas, cheese. A lot of times when I have a patient come back and they say, oh, we decided to add more fruit and we added in bananas and they're worse. So bananas are the one fruit that can be very constipating. So I tell them cut those out completely. Then you want to add in fiber. So fiber is great in vegetables if you look at non-starchy vegetables. So like leafy green vegetables, broccoli, spinach, any of those kind of things are great additions. If you look at fruits, prunes obviously, or plums are wonderful. Peaches, citrus fruit, all of those kind of things can also help loosen everything up and are a great source of fiber. Mango can also be really good. Adding fruits and vegetables into the diet is important. And then when you look at your carbohydrates, you want to look for whole grains. So I always say, look for the brown food, brown rice, whole wheat pasta. They make a pasta that actually is made out of lentils, so that's got a lot of fiber in it. When you're looking at cereals, go for the bran or the shredded wheat or those type of things. Look at the fiber content on the cereal boxes. Then there's also like the processed fibers, which I don't think are as great, but Fiber One makes granola bars and brownies and all kinds of other things that are full of fiber. So if your child is a junk foodaholic and that's all they're going to eat, there are other ways to get it, although I do believe whole, healthy, unprocessed foods are the better way to go. There are options out there. Now, one of the biggest things that's important is how much water you're drinking. So if you're not drinking enough water, obviously your poop is going to be hard. There's nothing in there to soften it up. So once you get the bulk that you need from the fiber, you also need the water to loosen it up, soften it up so that it can go through. A lot of kids are just drinking sodas or caffeinated drinks, and those can actually be fairly dehydrating because they have a diuretic effect. I recommend drinking a lot of water until every time you pee, your pee is clear. I say if you go to the bathroom and your pee looks dark, go drink some water because that means you need to drink more. It's hard to pick a hard and fast rule of how much water to drink because everybody's a different size and everybody processes it differently. But if you look at your own urine, that gives you a pretty good indicator of if you're drinking enough. So you want your pee to be light yellow to clear. So that's kind of an easy way for you to track it or for your child to track it. We can look at the natural stool softeners. So prunes are great. Prune juice is great. Not a lot of kids will drink prune juice. You can put it in smoothies and other things so that they don't really know that it's in there. My kids like prunes. I can give them whole prunes and they eat them because they don't eat a lot of sweet foods. So to them, that's kind of a nice sweet treat. But some kids won't eat them unless you hide them some way. So you can put prune juice in other kind of foods or things like that. Pear juice may be more palatable. It's sometimes hard to find, but I usually find it in the baby sections in stores. It's not always with the regular juices, but pear juice can be good. Apple juice is good too. All of those have that kind of natural stool softening agent in there. So applesauce or apple juice or whole apples, obviously, would all be good options. The next thing that's important to help get everything moving is actually exercise. So if you get your body moving, then your GI tract gets moving as well. So encouraging your kids to be active 30 to 45 minutes a day. So doing regular exercise will help keep everything regular as well. Another important factor is having a toilet routine. So especially for younger children, sometimes just having them get on the potty after every meal or at a particular time or whatever you're going to decide. For a lot of children, especially younger children, they have a big fear of missing out, and so they don't want to go to the bathroom because they want to be playing or doing whatever else they're used to doing. So getting them used to that, you have to go to the bathroom and sit there no matter what for at least a few minutes, can help to have just sort of a regular toilet routine. And then another thing that may help is probiotics or prebiotics. Probiotics are the natural bacteria that live in your gut. They also are in things like yogurt, kefir, fermented foods, so kimchi, sauerkraut, those type of things. Not a lot of kids are going to eat kimchi and sauerkraut, but they will eat yogurt. And kefir is basically a liquid yogurt. It's in the top shelf above the yogurt. It has a little bit of a tart taste, but my kids like it. They drink it, and that gives them lots of good probiotics. There are also prebiotics out there, and of the things that help your gut bacteria grow. So the more healthy gut bacteria you have, the more your gut's going to be able to process all the food that's in there and keep it moving. When we talk about medication in kids, in babies, the only thing we're really ever going to use is a Glycerin suppository. Glycerin is just this little kind of, it almost looks like a little tiny piece of soap. And when you go to the doctor, we'll put it in the bottom, let it sort of dissolve, and it will soften whatever hard stool is in there, and the baby can poop it out. Never do enemas, never do laxatives in babies. When we look at older children, we think about medicines like Miralax, which is basically a osmotic powder. So you mix this powder with water, it will go in there, kind of soften and bulk up your stool and help everything move through more clearly. You usually have to take it every day or twice a day, depending on how much you actually need. And your doctor can help you titrate what would be the right amount for your child on that. The other thing that we do often in the ER is we give enemas to children who have big hard stool balls that they just can't get out. An enema is a liquid medicine that we squirt in the bottom, and it basically goes in there and starts softening and breaking up that stool. The child will have to hold it in their bottom for about 15 minutes in order for it to work most effectively. Younger children really have a hard time with this sometimes. It is something that we do occasionally. We don't want to do it all the time on a regular basis because it can cause electrolyte abnormalities. On an emergent basis, when there's absolutely no other way to make it work, we do give enemas. So stimulant laxatives in children are a big no-no. We never do that in kids. When you do, it basically can cause all kinds of issues and can really cause more harm than good. So we never do any stimulant laxatives in children. So I hope you learned a little bit here today. I hope you can use this information to talk to your doctor. If you and your pediatrician have not been able to work out this constipation issue in your child, it may be time to see a GI specialist. If you've already gone through kind of all of the basic options with your pediatrician, there are conditions and things like that that a gastroenterologist would be able to help you with as well. I hope this was helpful. This is Dr. Lili with my Pocket Pediatrician. Thanks for coming by. Feel free to subscribe below, comment, let me know what you think, and I'd love to hear from you.
When the doctor says my child has a condition, I'll learn more at my Pocket Pediatrician.